All right, have this News ELA article up. Make sure that you are toggled to 7:30 and follow along as I read. The title of the article is Injured Knees Are More Common in Girls. Girls playing sports should be careful with their knees. A new study shows there is reason for worry. More and more kids are seriously injuring a part of their knee. The part that's getting hurt is known as the anterior cruciate ligament, or ACL. The ACL is not a bone, but a ligament, something a bit like a rubber band. It helps hold the bones of your legs together. If the ACL is stretched too far or torn, serious problems result. Girls have more reason to worry than boys, though. It turns out they're getting hurt more often. The new study compared girls and boys playing the same sport. It found that girls are up to 6 times more likely to have an ACL injury. You don't have to tackle to get hurt. Most injuries happen without kids even touching another player. Usually you feel a pop in the knee and then see swelling, says Dr. Randall Schultz. Sometimes it'll hurt, other times the pain might not be that bad. It's not something you have to go to the emergency room for, he says. However, you should see a doctor soon afterward. In the meantime, put ice on it and use crutches to try to stay off of it. Sports, where kids stop suddenly and turn in a different direction, usually are the cause. Such sports include soccer, gymnastics, volleyball, and basketball. Boys also saw problems with football, which is a contact sport. Although, along with those sports, doctors also see injuries arising from cheerleading and dance. The risk goes up for girls once they hit the age 12 or 13. For boys, it goes up around age 14 or 15. The teen years are a time when kids grow faster. Sometimes their bodies can't keep up. This is especially true of the leg's tibia and femur bone. With girls, the ligaments become looser during the teen years. With teen boys, the muscles generally become larger. This makes them more able to handle the quick growth of their bones. An ACL injury can stick around a long time. The number of kids with ACL injuries is on the rise because of a change in how kids play sports. These days, more kids are focusing on one sport all year with few breaks. Most kids used to play several different sports. They also took time off in between seasons. An ACL injury can have long-lasting effects. Athletes who've had one are very likely to develop arthritis in their knee. In fact, they are 10 times more likely than athletes who have never had one. I have daughters that play sports. I'm worried about it, Schultz says. An earlier study looked at the athletes older than 18 with an ACL injury. It found that long-lasting problems were common. About half of the athletes were never able to play as well as they had before their injury. Once you have an ACL injury, you are also more likely to have another. Knee exercises are important. So, what does this all mean for parents and for their daughters and sons? Here's one good idea. Look for a coach who has kids do knee-saving exercises. Bethany Thorson is an exercise expert. She says the best way to prevent an ACL injury is to strengthen the knee. It also is important to strengthen the hips and leg muscles. Parents should get realistic about how much sports their children are doing. Kids should have days off and they should be playing different sports. If a child is doing the same sport all year, she is overusing some muscle and not strengthening others. It's too much, Thorson said. They're not ready for it.